Rapid sequence intubation, or RSI, is a critical procedure. It helps doctors secure an airway quickly. This is vital in emergencies when someone can't breathe on their own. Time is of the essence in these situations. RSI helps avoid serious complications from lack of oxygen. Imagine a patient arriving after a car accident. They are unconscious and struggling to breathe. This is where RSI becomes a lifesaver. A trained medical team can use RSI to quickly establish an airway. This ensures the patient gets the oxygen they desperately need. RSI involves giving medications to sedate the patient and relax their airway muscles. Then a tube is inserted into the trachea. This tube acts as a secure airway, allowing for mechanical ventilation. This procedure is a cornerstone of emergency medicine. It is a prime example of how quick thinking and decisive action can mean the difference between life and death. RSI is a powerful tool, but not without its risks. Understanding when it's necessary and when it's contraindicated is crucial. RSI is frequently used in critical care settings. These include emergency departments, intensive care units, and during certain surgeries. Common scenarios where RSI might be needed include cardiac arrest, severe head injury, and drug overdose. However, there are times when RSI might not be the best course of action. For instance, if a patient is able to protect their own airway, RSI might not be necessary. Additionally, certain medical conditions like severe facial trauma might make RSI more challenging or risky. It's important to note that RSI is a procedure that requires specialized training and expertise. Doctors and nurses who perform RSI undergo rigorous training. This ensures they can perform the procedure safely and effectively. Making the decision to perform RSI involves a careful assessment of the patient's condition and potential risks and benefits. Before embarking on RSI, meticulous preparation is key. This is where the 7 Ps of RSI come into play. These steps ensure a smooth and safe procedure. Think of the 7 Ps as a checklist: preparation, pre-oxygenation, pre-treatment, paralysis with induction, positioning, placement with proof, and post-intubation management. Each P focuses on a specific aspect of preparation. For instance, preparation involves gathering all the necessary equipment. Pre-oxygenation ensures the patient has enough oxygen in their system before the procedure. Pre-treatment might involve administering medications to prepare the patient's body for intubation. Paralysis with induction focuses on giving medications to induce unconsciousness and relax airway muscles. Positioning is crucial for successful intubation. Placement with proof confirms the tube is correctly positioned. Post-intubation management involves ongoing care and monitoring after the procedure. By meticulously following the 7 Ps, medical teams can minimize risks and maximize the chances of a successful RSI procedure. Once the tube is in place, the work isn't over. Post-intubation care is just as vital as the procedure itself. This phase focuses on ensuring the patient is stable and managing any potential complications. One of the first steps is confirming the tube is correctly positioned. This can be done by listening to breath sounds and using a device to measure carbon dioxide levels. Continuous monitoring is essential to ensure the patient is receiving enough oxygen and that the tube remains in place. Like any medical procedure, RSI comes with potential complications. These can range from mild, such as a sore throat, to more serious, such as damage to the vocal cords or trachea. Managing these complications requires vigilance and prompt intervention. The medical team will be on the lookout for any signs of trouble and take appropriate action to address them. Post-intubation care also involves addressing the underlying condition that led to the need for RSI in the first place. This might involve further investigations, medications, or even surgery.